So this is going to be part 2 discussing my spinal fusion that I had on March 25th of 2024. I'm going to discuss the recovery room and the regular room at the hospital stay, and I'm going to try to be as detailed as possible. What I can tell you is I do not remember how long I was in the recovery room. I do remember them calling my name repeatedly. I was so out of it I could barely open my eyes. I just remember Jackie, 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 Jackie. I'm going to post a separate video about something that happened, but just watch that later on because that's a whole nother story. But within the recovery room, I remember the nurse, which I could barely even remember, like the sight of her, just so you know, you are so out of it. People were coming in and checking on me. And I remember the nurse trying to get me to drink water. And once I drank water, I was able to go up to my room. I was on the 6th floor. Cleveland Clinic is very big. My room number was 23, but it was H60-23. I was right across from the nurse station. That's another story. I was right across from the nurse station, and I was brought up into my room. And my family was all there. They all came up waiting for me, and they put me into the bed. What I will tell you is I did have a catheter in. I was unable to move at all, not even an inch, not even a little movement on my butt. I was stuck in a position. There was pain, but it wasn't immense pain because Cleveland Clinic is really great at managing the pain, which is fantastic. I am not somebody who takes narcotic drugs very well, but they were giving me Norcos. I believe they were giving me Toradol. I believe they were giving me Robaxin. So there was a plethora of pain medication being given to me to prevent me from feeling any of the pain, which was pretty successful, I will say. The only thing that was driving me crazy is that I just really couldn't do anything myself. I couldn't move. Now, I had not eaten the night before. It was like before midnight, and they brought me up, no offense to Cleveland Clinic or whatever, but they didn't ask me what I wanted. They didn't care to ask me what I wanted. I'm not really much of a seafood eater. They brought me up fish. Immediately felt nauseous as soon as I smelled it. My mom ended up going downstairs to Panera and getting me some broccoli cheddar soup just to get something on my stomach because they were giving me so much pain medication, and they had emptied my stomach in the surgery. So I was empty, and I am just that type of person that always has stomach problems. So I was nauseous. I felt agita, like I felt it. I had GERD. I felt it up here. And not that I didn't feel starving per se, but I felt like I needed to eat something. I needed something in my system. I don't think they were real happy with us because we were kind of bugging them for the food. But it was like 7 p.m. and I hadn't eaten anything yet. So it was kind of a nerve-wracking thing because once my mom left, I was basically, like I said, it got cut off. Once my mom left, I would have had nothing to eat whatsoever. Now, the nurses were pretty good about bringing me like a coffee, and they did bring me, what did they bring me? Something from their sitting area, like a Jello or something, which was better, way better than the fish that was sent up. The rice that they gave me was completely hard, and probably the only thing edible on the whole plate was fruit for me. And so like I said, my mom went and got me some soup, thank God. And that did hold me over till the next day. Now, the next morning, I did get a breakfast that was fantastic. Right up my alley, eggs, bacon, sausage. It was delicious. So I did not complain about the breakfast. It was good. But breakfast is very hard to mess up. That's all I'm going to say. I guess you're not there to eat great food. You're there to get better. But I feel like eating is a part of getting better, and they should focus on it just a little bit more. I know hospital food is not meant to be good, but you do need nutrition to get better. Logical. If you're in healthcare, you should know that. Okay, so anyways, back to the point. The next day they did take out the catheter. I was still not able to get up on my own, and I did have to be helped to the bathroom. I am going to be graphic for a second, so if you don't like graphic, don't listen. I had a very bloated stomach from all the gases that they put in there. I could not pee. I was having a really hard time peeing. You can't put pressure down there. It's my lumbar, so it was really hard for me to press down to pee or to go to the bathroom at all. And my stomach was like gigunda. I mean, there was so much air in it. They actually did x-rays on my stomach because the amount of air that was in there, it would just not escape. It would not come out no matter what. And I'm not trying to be gross or graphic, but it was a very hard situation. So let's shoot back to the pain meds really quickly. I am not somebody that takes narcotic medication very well. I just don't. Even after my car accident, they had given me hydrocodone. I stopped taking it on my own. I just don't like the way it makes me feel. It makes me completely out of it. Once I was able to swallow my own pills, they started giving me 2 Norcos every 4 hours. And I felt weird. I felt completely out of it. I don't know. That night, Tuesday night in the hospital, I got a severe headache, and I am telling you, my head was pounding up here. The nurse brought me an ice pack. I slept with an ice pack on my head the whole night. And the next morning, this little cute nurse, she was so tiny. She was probably 5'2". I'm 5'7". Okay, I'm a big girl. And this little tiny nurse, probably 5'1", 5'2", she was taking care of me, and she helped me to the bathroom. On my way back, I got extremely dizzy. This was on Wednesday morning. Extremely dizzy. Everything started spinning, and I told her I was going to pass out. I knew it was coming. I felt it coming. And don't ask me how this woman did it. She got me like pushed onto the bed, and she's holding me, and I'm laying on her forward because I went down. That was it. I was out. And I don't remember a lot of it, but a lot of the nurses and doctors came in and they had me up on the bed. But I am smart enough to know myself, and I knew that it was too much Norcos. So I myself, no doctor was going to cut it off, but I myself said, please cut it down to 1 every 4 to 6 hours, depending on pain, because I can't handle that amount of medication. And once I did that, that day changed. So once I was taking the medication down, yeah, a lot of people wouldn't do that, but I don't like that feeling of lack of control for myself. So I actually felt better by Wednesday night. By Thursday, I was like, Wednesday night, Thursday, I was sitting up eating. They released me on Thursday. So I got in Monday. The 25th was released the 28th. And I probably would not have been released if it hadn't been for me cutting down the Norcos. So, I mean, you just have to know yourself and your body. I just knew something was weird. They thought it was because I didn't go to the bathroom. It had nothing to do with that. It had to do with the fact that I was taking way too much pain medication for myself, and somebody that doesn't do anything, don't even smoke, that stuff. It was too much for me. So I just know myself, and I just told them to back it up. So you got to know yourself. You got to be able to speak for yourself, and you got to know yourself, because they don't know you. They have 2,000 patients. They don't know you like you know yourself. So it was because of me that I was able to get out of there.